Hi, I'm Dr. Ryoo. I'm here to tell you what to expect when you bring in your child for ear tubes. When you bring your child in, first we'll get you checked in at the desk, and then they'll bring you actually back to the preoperative area where nurses and other staff will get you and your child ready for the procedure. The procedure itself is pretty short. Your physician will go over a lot of the details with you, but in a nutshell, basically what happens is that your child goes back to the operating room. They undergo some anesthesia, and once the anesthesia has set in, we will go ahead and put in the ear tubes. The anesthesia involved with ear tubes is considered a general anesthetic. Your child is completely asleep, will not feel any pain. However, there are a couple different types of general anesthesia. Normally for ear tubes, it's a mask. There is no so-called breathing tube that's used. Every once in a blue moon, sometimes that needs to be done. Every once in a blue moon, sometimes there needs to be an IV, but it is fairly rare. It will take literally about 2 to 5 minutes. It probably actually takes longer to have your child go to sleep and wake up than to actually have the procedure done. After the procedure is done, the child goes back to the recovery area where they wake up a little bit more, and once they're awake enough to know where they are and what's going on, we come and get you, the parents. When your child goes home with you that day, they're usually fairly irritated with you that morning, probably due to the change in routine and all the new things that happened to them that day. Some of them remain drowsy throughout the remainder of the day. The next day is usually when they return back to normal activities, normal behavior. I will tell you that the second time my son got his ear tubes, he kind of had the opposite reaction. He was literally bouncing off the walls for the remainder of the day. Our anesthesiologists tell us that's fairly normal for some children after anesthesia, so if your child does act like that, you shouldn't be too surprised. Follow-up after ear tubes is usually up to your surgeon. It is typically about 4 to 6 weeks after surgery. At that appointment, we just like to check the ear tubes, make sure they're not clogged, make sure everything healed up all right, make sure that there are no questions from you or your child. In terms of water precautions, these also vary surgeon to surgeon. Most children do fine in treated water, things like swimming pools and the baby pool in the backyard. These are usually fine. It's dirty water that we get more concerned about, things like lakes and ponds and rivers and creeks. There's basically a lot of stuff growing in that water, and you don't want that stuff in your ears. So you guys probably remember the old hair growth commercials where the CEO said, "Not only am I the CEO of the company, but I'm also a customer." I have a darling 4-year-old boy who has been through ear tubes twice, and he did great both times. We were so happy that we ended up doing it, and it is pretty much as I have explained to my patients and have since explained to my patients in terms of how it went and how he did afterwards, and he's done great. So I can promise you everyone will try to make it as smooth as possible. I do not regret doing it one bit. If you have any questions, please feel free to ask your surgeon or contact our offices, and hopefully this video gave you some extra information and a little bit peace of mind.